So for this video, we're going to talk a little bit about hip issues or going through the examination on a typical hip issue. Just like in people with shoulder pain, that we want to distinguish whether their pain is coming from the shoulder versus referred from somewhere else, commonly in the neck, giving them the shoulder pain. Same thing goes with hip pain, is we want to see, is this a low back problem reproducing or referring pain to the hip, or is it truly a hip problem itself? So some of it is going to involve the typical low back exam that you may have seen on the other video, but some of it will be focused a little bit more on the hip itself. So I may skip through some of the steps for the low back since you've seen that probably before. But Claudia, I'm going to have you stand facing that way. Again, we're going to start off with a basic evaluation of posture and see if everything is aligned fairly well. The base of the skull, the shoulders, the hip. We want to make sure that those are level, and then going down to the feet, checking for flat-footedness on one side and not the other, pronation, which is when the Achilles heel or the Achilles tendons from behind are kind of bowing in. And again, most importantly, is it happening on one side and not the other? Because that gives us some structural imbalance that we'll need to deal with, even though the pain may be somewhere else. So next thing we'll do is, Claudia, if you can bend forward, and she'd be telling me if she has back pain. If she's pointing to pain in the back, that starts to kind of go into the hip, and you can come on back up again. We would know that this may be hip pain that's really coming from the back. When she was bending forward also, we look to see if one side of her back is higher than the other, because that can be an indication that she may have some curvature in her spine, which again, all of these imbalances and all this information is real critical when we're kind of putting this together with the consult and the x-rays or MRI if we need that. And then we'd have her extending backwards and then back up, and some other back motions to see if she's complaining about that hip pain. But assuming she does not, and we're not suspecting that it comes from the low back on the consultation, the next step is we'd be stressing more of the hip itself. So we'll have Claudia lie on your back. And again, we'd be reproducing some of what we did in the low back examination. Here we're paying a little bit more attention to what's happening at the hip joint itself and the surrounding soft tissue. So again, we do the kind of straight leg raising to check the hamstring flexibility and just to see the range of motion in the joint itself. Bending, we can stress the joint a little bit more. So when we're thinking about something like arthritis in the hip being the source of her hip pain, a typical thing for arthritis would be reduced range of motion in that joint, particularly when we come to what's called internal rotation. This maneuver here tends to be real restricted. We would check this direction as well, and then we'd even do some what's called circumduction. A lot of times people are arthritic when we start to round into this area. It doesn't want to go all the way in. It stops here and kind of comes down. It just doesn't go through a normal circular range of motion. And then we go across like this and just lay it down. We'd be putting a little bit of stress, and she's pretty tight in that musculature. We'd expect this leg to come straight across, and you can see there's a lot of inflexibility in the front portion of her hip, which is important for me to note. We'd also want to check by kind of coming up in various directions here, kind of stressing the piriformis muscle, the gluteus muscle, and seeing if any of that is reproducing the hip pain. And the location of the hip pain is critical as well, whether it's more groin pain, which we would suspect is more in the joint, or if she's talking about pain in the lateral or outside portion of the hip, we would suspect things like bursitis and so forth, or various strains of the surrounding musculature. So after we do that, we'll have Claudia go on her stomach. And again, we're checking for range of motion and flexibility. We check the quadriceps. Heel should be able to touch the buttock or be pretty close. We'd be doing some internal or external rotation and some internal rotation. And she's got a little tightness on the external rotation, which is why she had problems, you know, kind of making that sign of 4 when she was on her back. And then we checked the hip flexors and the amount of extension that she has in the hip. And again, all at the same time, we're seeing, you know, where is this pain being reproduced? If she's talking about a lot of back pain, then we got to suspect that there's, you know, her pain is really radiating pain from her back and not with something in the hip itself. We're going to check, just like we did in the low back exam, for leg length to see if the legs look visually equal. Again, we'll double check that when we take some standing x-rays and get a shot of the pelvis. Not only looking at the hip joint itself to see if there's things like arthritis, but also to see if the top of the leg bones on each side are level or within a 1/4 inch of each other is fine. When we be continuing here on more low back examination. And then we come in specifically checking for issues in the low back by doing some palpatory things, and then getting around into the hip itself and putting pressure on the various tissues. You know, we'd suspect bursal tissue to kind of hurt over what we call the greater trochanter, this big prominence of bone here on the side and slightly behind that. And with a bursitis, we'd expect that that pain would be reproduced in that area with some of those other mechanical tests. We can come in, sometimes just the gluteal muscle itself can be tight or even have trigger points and knots, which can refer pain even down into the leg. That's called a myofascial pain syndrome. Or we can kind of come in to the musculature here in the lower back. Sometimes knotting occurs there, which will reproduce or radiate the pain in through here, and it's coming from a muscle in the lower back. And then we'd be basically stressing different points of the pelvis. There are other mechanical movements that we would do to see how the pelvis itself is moving in relationship to the opposite side and also to the lower back. And, you know, by stressing and mechanically, again, trying to reproduce the pain, that along with the consult and the examination, consult and the x-rays will help us really pinpoint the problem. So I just wanted to show you a typical kind of hip exam that isn't even the whole thing, but it's pretty much a good demonstration of a typical hip exam, just so if you do come in, you'll know what to expect.